Women access the healthcare system very often. This can be both for themselves and on behalf of their children. Many become pregnant during their lives, and women's health research guides any obstacles before, during, and after pregnancy. Anovulation is an obstacle that women may face. It is the lack or absence of ovulation and is a common cause of infertility. So what causes anovulation? It is often the result of a hormonal imbalance and is indicated by irregular menstruation. PCOS is a hormonal disorder associated with reproductive morbidity. It affects up to 10% of women and it is the most common endocrine disorder. This woman can make lifestyle changes to combat anovulation. There is research conducted to measure the effect of physical activity on ovulation. The research is critical to improve guidelines and advance infertility therapy. It is known that underweight and overweight women have higher incidence of irregular menstruation and ovulation disturbance. So then how can we use physical activity to treat infertility? The objective of this review was to assess the effect of physical activity on ovulation. Like many of us, researchers ask questions. Author of this systematic review, Osnat Hakimi, could have asked himself, how can existing guidelines for women who are wishing to conceive be improved? And how can physical activity help women suffering from anovulatory infertility? In Hakimi's Effect of Exercise on Ovulation, a systematic review, literature published up until April 2016 was searched. Keywords for this search included ovulation, anovulatory, fertility, sport, physical activity, and exercise. Measurable events within the analysed papers included anovulation, ovulation, and ovarian morphology. These fancy words basically mean that the useful data from research included the participant's menstrual cycle and its normality. Women with low BMI were at the highest risk of anovulatory fertility overall. 2 observational studies evaluated heavy physical exercise and its risk. Women who exercised only 30 to 60 minutes per day had reduced risk. The association between exercise, BMI, and ovulation is U-shaped. Women who are on extreme sides of high BMI and low BMI are more likely to suffer from hormonal impairment and anovulation. Exercise is more likely to be beneficial to overweight women and harmful to underweight women. Exercise that does not cause energy deficiency can be beneficial to improving fertility in most women. Finally, how can we use physical activity to positively modulate ovulation? Exercise regimes have the possibility, if implicated correctly, to help so many women through infertility. They can provide lifelong health benefits, affordable infertility treatments, and are accessible for all women. If you are a woman experiencing infertility, ask your health professionals for guidance on physical activity. A therapeutic exercise regime may be helpful for you.